Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Doll Simons Family Studio. Delighted to be back with you. You know, I was out fly fishing this last weekend. Man, I was in the Ozarks, and it rained, and it rained, and it rained, and the water rose. It's kind of like that Johnny Cash song, 6 feet high and rising. I'm not going to bother to sing that to you. I'm sorry about that. But as we were there, I was trying to think, man, beat me up, Scotty. I got to find some place that's going to be a little bit dry and a little bit better for fly fishing. Man, the river's a lot of water, a little bit of mud. We caught a few trout. Still had a great time down at Sand Springs Resort by the Niagara River. Beautiful place.
I'm surprised you didn't melt because you're so sweet.
Oh, yeah, that's what happens to me in the rain. What do you want, Hawkeye?
And the other thing, don't ever apologize for your singing. Just offer a redo.
Okay, well, I'll keep doing that because I'm happy to belt out a tune. I'm not sure about everybody wanting to listen. How are the numbers today?
Numbers are still pretty good.
They're still. I know we'd gone up to 11 yesterday from 5.
Yeah.
How are we today?
We're still at 11.
Okay.
3 in the ICU, 1 on the ventilator with 20 in that recovery period. Hayes over the weekend still had low numbers. As of Saturday, they had 1 acute and 2 in that recovery period. And, you know, looking on the New York Times and the national cases, but also Kansas City Star and the local cases around here, still that number is still pretty low, just over 100. But I think if we can keep as low as possible, certainly under 120, under 150 new cases per day in the metro area, that'll be good.
Fauci spoke over the weekend being afraid of another surge, and one coming because we kind of plateaued and now behaviors are changing. What are your thoughts?
You know, I think it's reasonable. A lot of that will also be determined by the variants spread. We know that is happening in Italy, that they had to go back into a shutdown or lockdown because they had loosened restrictions. It seems like the variants or the UK variant, the B117, seems to be spreading there quite readily, so they had to go. We certainly don't want to do that. We want to keep people in school. We want to keep people working, restaurants, all that stuff as much as possible. So it is down to, again, individuals doing the right thing, which I think we've seen a lot better evidence of that these past 6 months.
I think we have, and we've kind of bent, maybe at a time squashed the curve, but now I'm a little nervous because I know a lot of people are headed down to spring break in Florida. Mask requirements seem to be lessening a little, and the variants are out there. We don't have everybody vaccinated yet. So I think we're at a perfect storm here with this precipice where people are like, I don't want to be normal, but you're not vaccinated. And so I think and it looks like having had COVID doesn't protect against some of these variants, especially some of them coming out that we know from Brazil, the B.1 variant. If COVID doesn't protect you from the variant, you're likely to get it again, which means we could all get sick unless you're vaccinated. I don't think we're going to see the things we've seen before in the nursing homes because I believe that we're much better with that. Hopefully not the same number of hospitalizations, but I'm afraid a lot of people could be getting sick again.
Yeah, you know, absolutely. That is out there. We're worried about, I saw pictures yesterday on CNN.com about people down on spring break just gathering together without masks. We hope that we can stop and prevent that. And we know that, natural infection and recovery, we don't really know how it does. We hope and believe that it will offer you better protection against the disease and the symptoms, but we've also seen published reports, very good published reports, that show that you actually have worse disease and you have worse outcomes. So it's really difficult to say. I don't think we can make any across-the-board recommendations or descriptions of what happens with reinfection, but we know that reinfection can occur.
Well, let's see if there are reporter questions out there this morning first.
I have 3 that were sent to me over the weekend. Heidi with Fox 4 wants to know, what happens if I lose my vaccination card? I know I don't need it to get a booster, but I may need it to travel or for school at some point. How do I get a replacement?
That's a great question. We're trying to research that over the weekend because I saw that question come in. I asked a couple of heads of our vaccination program, and I haven't found out the answer yet, so I still have to find out that answer. Here's what I think will happen, though. I don't think those vaccine cards that you've received at the vaccine can necessarily become a vaccine passport, if you will, because they're not very permanent. So I was out fishing this week, and I took my vaccine card with me. It's in my wallet. I got wet. The water rose. may have kind of had a little slide in the river a bit. And so my wallet got wet, and so did the vaccine card, and then the ink all blurred. You can't tell anything on it. So they're not really a permanent device. So right now, I wouldn't be concerned about that. I would take a picture with your phone. I think that's a great idea. If we go to the point of having a vaccine passport, I think we're going to have to do it a little differently. Many places, now for our patients at least who are being vaccinated here at KU, you'll be in Epic and you can get it in MyChart. But I don't know what's going to happen for all the other places. I know the pharmacies are doing more and more work around vaccination, doing a great job. I think they appear to be more open to me than the health departments. They have a different set of guidelines because they don't get their vaccine through the states, or at least they seem to be giving the vaccine to just about anybody. And I think that what we're going to have to do is come up with a long-term solution besides that little card. If indeed there are, if indeed you're going to have a vaccine passport. Thoughts?
Yeah, I would imagine CVS and Walgreens would have pretty good electronic record of, number one, your prescriptions, and if you do come in to get your vaccines, whether that's shingles vaccines, your pneumococcal or pneumonia vaccines, your yearly influenza vaccines, they should probably have that on record that they could probably easily print. I know CVS uses MyChart as well, which is another thing that Epic uses, so hopefully you can link that information there. But I agree with you as far as it's not permanent, and who knows what exactly you're going to need to be able to present to get into any private businesses or whatever that might be.
Heidi's follow-up question to that is, she sees a lot of people that are posting their vaccination cards proudly on Facebook. She wants to know what information can be stolen from that card. Anything?
Yeah, I don't know. There's like your date of birth and your name.
Date of birth
that
and
could be
name,
it. I'd show you my vaccine card right now, but I can't because it's a little wet and can't really read it at the moment. So I'm going to try and get a new one here at the health system.
Yeah. I don't think there is a lot. I did notice some other friends of mine that are in the TV business, and they were just blocking it out.
Yeah.
Like with on your cell phone when you paint on your picture.
Yeah.
So they were just things that they didn't want to share, like their name or their address or that kind of thing.
Well, I think that's right, and I think you just got to be careful showing your identifiable information, whether it's on your vaccine card or any other source of information. You wouldn't want to show that online because of the amount of identity theft, I think.
Yeah. All right, so Chris with Channel 5, he has a question. Have you heard about any local studies involving children getting the Moderna vaccine? They're going to start that apparently in Arizona on Monday.
Yeah,
and I don't know if it's this Monday, today, or next.
Is Children's doing it with Moderna? I'm not sure.
I don't know what they're doing.
So we'd have to ask Dr. Pahood to find out.
We know that Dr. Pahood and her group over there at Children's is very active in getting it.
Yeah, I know they're in a couple of I know they're a major vaccine site for kids. I think it is Moderna. I think that's right, but I don't want to quote that because I knew they were getting ready to get started. I know they said they had a lot of people wanting to volunteer, a lot of children volunteering. But I don't remember which vaccine it is, to be certain with that. That's a question for them.
Well, she and Dr. Mario Castro are your guests next Monday.
I know. Well, we'll have all the answers then.
Yeah, tune in on next Monday.
And maybe we'll learn more about the AstraZeneca vaccine because, Hawk, more news over the weekend that more countries are suspending the use of the AstraZeneca vaccine over concerns about clotting.
Yeah, and all we know is that AstraZeneca put out their statement saying, I think it was 15 cases of blood clots in your limbs, which we call DVT or deep vein thrombosis, and like 22 blood clots in your lungs, which we call pulmonary embolus or PE, in 17 million people that have been vaccinated. And what they say is that is actually lower than the general community rate of DVT and PE as well. So it's being investigated by those countries and looking at safety, but that is their statement right now.
Okay.
And final question that I have from reporters today comes from Kyle. He's with the Shawnee Mission Post. He said, I got an alert in my box over the weekend from the University of Kansas Health System saying that he could start signing up for shots. He said that we were getting doses from Johnson County. He goes, is that new or has that been happening? And the follow-up question is, then he saw on another TV station that we would be focusing on critical industry workers, grocery store, meat processing employees, blah, blah, blah. Is that true? Can you kind of summarize who are the employees that, or not, but who are the people we're getting ready to vaccinate?
Yeah, I think it's, and we can both comment on this. I think what our situation is right now, we're only getting vaccinations from Johnson County Health Department. And so we have to give those to Johnson County residents. Johnson County started with those over 65 and are now moving into essential workers. Wyandotte started with essential workers and teachers and then moved into those over 65. That was just some of the prerogative of the individual counties. And so in Johnson County, we've been asked to start doing those vaccinations in some of the very areas you mentioned. They're considered folks who are considered essential workers as the county nears completion of those over 65 who have agreed to take the shot. And I think that's the direction we've been going. And when we notify patients, we notify multiple modalities. We do phone calls, email, snail mail, text messaging, and MyChart. And that way we try to make sure we get to everybody we can.
And do you know so how it started early was that, we were a distribution site when the state got their initial doses of Pfizer.
Yeah.
So we were able to distribute them. Again, mostly that was with our healthcare workers, but then the distribution changed where it was going from the state to the local health department. So we are getting our vaccination from Johnson County Health Department right now. Wyandotte County has their mass vaccinations going on. So they are really trying to deal with their residents in their counties. But when we were on, we had Lee Norman on last week, and he said, if you live or work in Kansas, you can get a vaccine. It's not based on the state lines for that. So even if you live or work here, you can still get that. I'm not sure if that's true for the Johnson County issue as well.
Yeah, we're only allowed to do Johnson County residents, and the vaccinations, we get about 1,200 or so a week coming from the county. We think those numbers are going to escalate because vaccine production is lifting off in the United States. You can begin to feel that. As I said, the pharmacies, I think, are doing a great job of vaccinating people, and I think we're going to count on a lot more vaccine coming. I think the numbers could quadruple. If we hit we're getting about 25,000. We can get 100,000 doses a week. That's great. I think it could even escalate above that. And as it does, hopefully everybody will surrender their arms, follow the call to arms to be vaccinated. So, all right. Well, we have a couple of really cool guests this morning. We're excited to have back the president and CEO of the Kansas Leadership Center with his guest, KLC field team member and leadership facilitator, Claudia Amaro. So Claudia, unfortunately, her video link has failed, and so we're going to have her on phone link. When we last spoke with these two great folks, they were doing some work trying to get 1,000 meetings scheduled before the end of 2020 to teach and educate on COVID-19 virus and on the vaccination and how close that is or how important that is. So let's turn to them and find out, how did that go as they approach the end of the year? So Ed, how did things go?
Well, doctors, first of all, thanks for the opportunity to be back on the show. It was a phenomenal experience. We set that high goal, 1,000 meetings, all within 5 weeks between Thanksgiving and New Year's Day. We didn't hit 1,000, but we hit 851, which during the holidays, having never done something like this before, we were thrilled with that result. 851, we called them community action meetings. These were groups of people throughout the state of Kansas gathering together to discover what they could be for in order to help slow the spread of the pandemic. It was super inspiring, a great example of massive action in the grassroots. And I know your doctors and everybody connected to the hospital and the healthcare system have been working so hard. I hope this story helps them feel a sense of encouragement that there were all sorts of folks on the ground, 7,000 Kansans almost altogether involved, working super hard to do their part to slow the spread, especially in the lead up to that difficult holiday season.
Yeah, I think that was incredible work. Just the fact that you could do 850 during that time frame to me is remarkable, and that just impressive. Why do you think people were so energized? Was there a secret sauce that helped motivate them?
I think the key, and Claudia could talk more about this as well, I think the key is that it's all about relationships. So we've done a lot of research and surveys since those meetings ended. And one of the things we're finding is that when somebody asks you to engage, or when somebody asks you to wear a mask, or asks you to get vaccinated, people engage and they say yes. So there's something here about we need the experts, but we also around doing those they care about, those who listen to them, those who they have influence over. So I think the secret sauce is all about relationships. It kind of was an unleashing of relationships across the state of Kansas to mobilize people for the greater good.
I think that makes sense. So, Claudia, talk a little bit about some of those personal conversations. Tell us, what were some of the things that were most memorable to you?
Well, everything was very interested in, like Ed said, relationship, trust, that played a big role on that campaign. And I'm just really excited. One of the things that I'm really happy about is that over 200 Latinos participated on that campaign from all over the state. And that's just on the conversations. But when I saw the pictures of the actions that they were doing, they were sending me all kinds of pictures and goodies of the things that they were doing after the conversations. I know they engage even more and more people. And the reason I mentioned the Latinos is because, usually I keep hearing before this, I hope this changes, but I keep hearing well, Latinos never get engaged. Well, I've heard things like Latinos don't like to live in community. I'm like, if you ever been to Mexico or other country in Latin America, you know that we own the streets. But again, going back to that factor of trust and that factor of somebody I know is invited me to the table, I think that was very powerful.
I think that makes a lot of sense. So talk to us a little bit. What is your focus now around COVID-19?
We are working, continue to engage with the community and especially listening. We love to listen, and we've been listening the different opinions and the different thoughts that people have around vaccination. So right now we're kind of listening and see where they are. They have some myths and facts, and we also, as as leaders in the community, have myths and facts. It's been surprised to listen to them. Like maybe at the beginning, one of the things that I thought was that most Latinos, they don't trust and they don't want to get the vaccine, and part of that is kind of true. By listening to them, there's a lack of trust because there's a lack of information in their language. But at the same time, at the end of those conversations, is like they understand how important the vaccine is for everyone in the community. It's just like they're not there yet, many of them, because they don't have the information. And again, they keep asking, we want leaders from the Hispanic community. We want people that we know out there delivering the message, because a lot of them, all of the information they're getting is from the national sources. And a lot of the times those news are pretty fast and quick, and they end up with not a solid information, but at the end you decide what you want to do. So they kind of feel like some negative messaging in the national level, and they're hungry for more local information in their language.
So as you look at this story as we come up, how can we get folks all around? Because I know in some areas the uptake of the virus, even for those who are most vulnerable, age 65 and older, has been about 50% or less in some counties. How do we get people involved? What do you think we need to do? Ed?
I think there are.
Claudia?
Sorry, go ahead.
Either one.
Well, go ahead, Claudia, and then I'll chime in after you.
Yeah, I think there are already a lot of people in their own communities working. It's a matter of connecting. Like I was just seeing on the Kansas Hispanic and Latin America Affairs Commission Facebook group that many Spanish media reporters and people came together, even though their competition in the regular life, they came together to deliver that message. So I guess connection is going to be a key piece on this, connecting with those leaders on rural areas. A lot of the hospitals, they have, people who are champions of the messages and champions of the work that they're doing. So connecting with those people who already know the community, I think that's going to be key.
Cool.
Doctor, I would chime in with three quick things in terms of what we need to do going forward to get more uptake into vaccine, just from our perspective, given our experience. Number one, it's listening. We've done, just in the last few weeks, over 50, Claudia's been a big part of this, community listening sessions in diverse populations, just to hear their thoughts and concerns and questions, and to help get their voices really on the eventual messaging that'll be out in communities about vaccination. So number one, it's listening. Number two, I think that the second key is we got to give people something to be for. There are a lot of political debates going on. There are a lot of controversies that have propped up about masks and whatnot. We've just eliminated that from our discussions, and we focused on what can people be for. And the third thing is we've got to give people a chance to get active. We've got to ask more of people. Back in World War II, everybody had their, victory gardens. I think that's a key to this success we've had in Kansas the last few weeks with slowing the spread, and a key to the success we'll have at getting more people vaccinated. We've got to ask more of people, have them get engaged. And when they do that, it increases their commitment, and they can influence those that they care about, who listen to them more than you or I ever could. So I think those are three keys going forward.
Yeah, I think what you guys have said is really good. And Dana, I think what I'm hearing is, gosh, the more messages that come from people you trust, the better off you are. And give people something to be for, not just against, something to be for and a reason to be for it. Try and touch their lives.
Yeah, and we certainly try to do that. We try to present our message. We know it's very important for any members of their local community to present that message to them as well. I mean, we've talked about that from the beginning, from even when we were talking about the infection itself, and it doesn't affect certain people and it does affect other people. We've tried to dispel those rumors and really tried to get out the accurate message to every community by utilizing people that they trust, because that is important.
I think it's a labor of love, and we appreciate the love you all show for the communities around Kansas and around our area to help get them involved with the idea of getting a vaccine. That is just so incredibly important in the long run. And I think the other thing that has been one of the silver linings of the pandemic, and also one of the dangers of the pandemic, people not getting out as much. I've found, in fairness, I still work a lot, and I still see a lot of good folks every day. I think a lot of people don't have that in their world, so they need to get out more. Got to still trying to help support them. I think having the time to be a little more still has been good for some of us who are a little crazy. So I think getting this message out that you can get vaccinated so that you can get out and be for something, be for a little, more social contact, being back in life again. I think that's a really good message to get out there, along with make sure you still take time for yourself and still sit still sometimes. Jill, let's see if there are questions out there from our audience.
Always. And I think we have an opportunity to do a little bit more myth busting.
All right. I love to bust some myths.
All right. So the first question from Michelle for the panel is, how do you respond to those who say the vaccines are not even FDA approved, that they're only approved for emergency use, and people are the animal research?
Well, clearly we are not animal research, or it wouldn't have been approved at all.
Yeah.
I think what we can say about it is that, and Hawkeye will join with me here, but the vaccines have been shown to be incredibly effective with very few side effects, and all of the vaccines are coming in really pretty similarly, right? Mm-hmm. Even the Russian Sputnik numbers look pretty similar to Moderna, Pfizer, and now J&J. And I think that when you look at that data, you have to say that is really impressive data. That's not experimentation. Second of all, vaccine science has been around for years and years and generations. So we know what to expect. This is a spin, but on the same story. And so it's not some an entirely new concept. And actually, even the Moderna and Pfizer vaccines, the mRNA technology has been around for around 8 to 10 years, been used in other people, both with MERS and with SARS-CoV-1. So this isn't really new. It's new because it's got a different target because of SARS-CoV-2, but the science of vaccines is really the science of vaccines. And I remember when Dr. Pollard was on with us from Mayo Clinic, it's like, look, if you don't get sick in the first 6 weeks from a vaccine, it just ain't going to happen. And now we have given millions and millions and millions of doses. It's been more than 6 weeks, and we're all doing okay.
Yeah, and to be fair, all of these vaccines were trialed first in primates, so in monkeys for the initial trials, and then they moved to the human studies, and that is what we base the emergency use authorization. But we continue to collect data and analyze that data, and again, it still shows that these are safe vaccines.
And I think the point about is it an EUA, early use authorization, or fully approved is a good one.
Yeah.
So let's explore that a little bit. An early use authorization is always given at the time of real medical emergency when there aren't alternatives available. And that was clearly the case here for this. Would you have liked to have had another 2 years to complete all the clinical trials and follow-up? You bet. But you couldn't. So here's what you have to do. You have to weigh the risks. And what's greater? The risk of getting COVID, and when the odds of death are, we've seen 525,000 Americans die, actually now more, probably closer to 550,000 Americans die from COVID-19. They did not die from it. They died because they got COVID-19.
Yeah.
Or the risk of death from a vaccination. And after millions and millions of people have been given these vaccines across the world in the United States, how many people have died from the vaccination? The answer is there haven't been any. Yeah. So you tell me which has the greater risk, COVID-19 or the vaccine?
Yeah, and I think a good point to that is I heard this argument again yesterday. It continues to go back to death. Oh, the risk of death is, I think right now on the Johns Hopkins the case fatality is like 1.5% or something. We knew it was much higher with MERS, and we knew it was much higher with SARS. But the whole story isn't about mortality, and we've tried to say that. It's not about death. It is about illness. It's about severe economic loss from not being able to go to work. It is the high risk, much higher risk of blood clots from getting COVID-19 rather than from, say, the AstraZeneca vaccine. So it is all those risks. It's missed days of work. It's the chance or the prospect of potentially spreading that disease to somebody that you know and love. So it's not just about the mortality either. It is about all those other topics as well.
If you remember from our own hospitalization data, we would often have 30, 40, 100 people out with COVID-19.
Yeah.
Now we have 0, 1, or 2 that we got 85% of our team vaccinated, and the ones who didn't get vaccinated are the ones who still get sick. So there is no mystery. There is no there's no alternative scheme here. There's no terrible evil lurking in the night. The reality is you have a choice, and the choice is which set of risks do you want to take? A drug that has an early use authorization and not fully FDA approved, although it appears to be remarkably safe and is based on technology that's been around for generations, or COVID-19. I think all of us have seen a lot of death. I don't think you want to see that.
All right, Cindy's asking, what are the biggest objections that the panel across Western Kansas is hearing among vaccine-hesitant groups?
Let me turn to our Kansas leadership folks and say, Ed, Claudia, what are you hearing are reasons people don't want to get vaccinated?
These 50 community meetings we've had in the last just few weeks, these are different than the 850 that we had prior to the holidays. These meetings lately have been with diverse populations, focusing on really listening about what are their concerns related to the vaccine, what questions do they have. It's been mainly with diverse populations. Claudia, you've been a part of a lot of those. I'll let you speak to those, and then I'll chime in with some general thoughts as well. Claudia?
Yeah, sure. Definitely, like I told you earlier, they just need more information. They want more information. Again, like I said at the beginning, when the conversation starts, everybody, has a lot of doubt and a lot of their own version of what they understand about the vaccine. But at the end, with some of the questions that we ask, like I said, they know and they understand the importance. I think they're just hesitant because they want more information. Just like what you were sharing, Doctor, a little bit earlier. I wish we could have that information, in Spanish or for people like blind people, people with disabilities. How are we reaching out and giving that message, assuring them that there has been enough, like from an expert like you, so that's the information that these people are lacking, where somebody can assure them what the process was for the vaccine and that, like, and historically in some of those communities, like, with the Hispanic community many years ago, they were being like, the women were being sterilized without their consent and things like that in the past. So historically also there's like a trust issue there with some of those communities, same with the Native American community. So again, they need to listen from experts, from people who they trust.
Yeah, I would add in, so one, it's about listening. So it's about, I think people who are hesitant, what we're finding is they want to be heard. They want somebody to listen to them, to be able to talk about their concerns. They want somebody who will ask them questions about their concerns, not dismiss their concern quickly and tell them, what they should think. So it's about listening, I think. But I also sense beyond some of the diverse populations that in some of our small towns across Kansas, especially out west, they're so isolated that I've sensed this throughout the pandemic. They feel a sense of security given that isolation. And you all know much better than I do that COVID-19 is spreading everywhere, regardless, or was, and now it's on the decline. But I think that sense of small town, rural security that a lot of them feel has been one of the biggest challenges. I gave a speech out in a little town in Kansas back in August or September. I think I was the only person in a mask that I saw in the entire town. So I think that sense of security is one of the issues as well that might lead to vaccine hesitancy in some of their more rural places of the state. They just might not feel like they don't need it. They do. We hope we'll be able to help reach them, and we'll reach them by engaging them, listening, letting them share their thoughts and feelings, asking more questions, sharing information, and ideally getting people they care and trust to convey information that's necessary to help them think through their decision about the vaccine.
Hawkeye, what do you think?
Yeah, no, I agree. I think, you look at, in particular, Claudia brought up the Native American community. We know that I believe it was maybe the Navajo Nation, or at least one of our communities, I believe in New Mexico, that was hit exceedingly hard from the virus. Had just some of the highest rates of infection and death in the nation at that time. I think it's hopefully going to be easy for those communities to say, yes, we've seen the devastation and what happens. Same thing for childhood vaccines. We don't understand what those illnesses were like, measles, mumps, rubella, because we had vaccination. But you don't want your children to get those illnesses. Same thing for COVID. That community, that Native American community, has been hit so hard. Hopefully the uptake in that group is, and really all the groups, are a lot better because they've seen the actual devastation. And sometimes it takes testimonials from those communities to say, look, we know what happens, and we know that getting the disease is much worse than getting this safe vaccine if it can help prevent some of the further devastation, suffering, hospitalization, and death that we can do. And so it is just important to continue to get that message out there and hopefully show the people from these communities that we are doing it as well, and you can do it in your communities and protect those people around you.
Yeah, and I would say that for a while it was hard because, even at the federal level, there was mixed messaging coming out. And I think that bred a little bit of suspicion, a little bit of mistrust. And I think what we're seeing is a much more consistent message among leaders. And I think people are responding to that. Still seeing a lot of it about masking people, especially in rural communities, not wanting to mask as much. But I do think there's greater acceptance of the vaccine. And I think the other thing that will help us is millions and millions and millions of people get vaccinated. And those people do well. And people don't get vaccinated. A, first of all, they're going to see some friends being vaccinated. That'll help. B, they're going to see people not dying from the vaccine. That's going to help. And C, they're going to see the vaccinated people being able to go out and do stuff that the people who aren't vaccinated are going to be at greater risk for. I think that's going to help. I think there will be a tidal wave of momentum that pushes people toward vaccination. I think that's really important. And if you don't believe us here in the hospital, go look at the nursing home data, because the patients being admitted from nursing home have plummeted like a rock, at least from COVID-19. And that's been one of the best features. We just don't get those admissions now. And it's because of the vaccination. So I'm hoping that messaging and momentum together equals success. And I think that's going to be that's the equation I'm going to count on.
Stacy says, I work with Spanish-speaking families. Most are desperately afraid they will be the last to receive the vaccine. What resources are out there in Spanish that we can share with them to help them get signed up?
Well, Claudia, I think that question is right up your alley. And then what I'm hearing is, I know as a health system, we're trying to get our messages bilingual. I don't know where we are on that. We spoke about that about 10 days ago at one of our vaccine meetings, but I'm not sure how we're doing with that. But we'll follow up on that question. Jill, did you have?
I do. I do know that Dr. Ed Ellerbeck has a public health grant, and he's working with Juntos, and he's asked our team to engage. So we're looking at trying to do some podcasting on that. But in terms of like, how do they sign up right now? I don't have information.
We're going to find out, 'cause I think we do have it bilingual. Let's find out. Claudia, what are you doing out there? What are you hearing in the community, and Ed?
Definitely in the last few years, I want to say the last couple of years, the governor of the state is really doing a better job than before on reaching out to our Hispanic community. Juntos Casey, I think that's part of it's under KU. They're doing amazing marketing. Kansas Health Foundation as well. They're doing amazing marketing in Spanish. We're hoping to get out some material in Spanish as well. And like I said, more and more, the Kansas Department of Health and Environment is doing more. The Sedgwick County, for example, they have gone beyond everything they can, and they're trying to do even like the media releases in Spanish. So definitely there's more effort, and there's more people really trying to do that. And most of that material is, that's what we want. We want it to be shared. So you can go to the KLAC, the Kansas Hispanic and Latin American Affairs Commission. They're doing a great job of bringing all of those resources together and posting them on their social media. And you're welcome to grab them from there if you need it. And like I said, Kansas Health Foundation, Kansas Leadership Center will soon, and Ed can talk to you a little bit more about that. We'll soon launch a website where we're hope to have a lot more information for with more like multicultural like messaging.
And I would have to guess too that Wyandotte County probably has a very good informational site, a bilingual site as well. So
yeah,
I would have to believe that.
That's a great question. We need to get those guys back sometime soon.
Okay, I'll work on that.
Yep.
Diane wants to know, if someone is 21 weeks pregnant and is afraid to get the vaccine, if this was your wife, what would you tell her to do? Any guidance?
Hawk?
I would say get the vaccine.
I would say get the vaccine.
We know that the numbers for women who are pregnant compared to women who are not pregnant, they do have a higher risk of going to the hospital and going to the ICU. So, we know that risk is there. We know that there is little to no risk in getting the vaccine, and we know that the OB/GYN societies, as we had Dr. Weinecke on here several times, their guidance is if you are pregnant or breastfeeding and you are offered that vaccine, go ahead and get the vaccine.
Yeah, I think they said make sure your OB doctor agrees and there's no concerns, but probably go ahead and think about going and proceeding, or some areas, if you follow with your family medicine physician for your pregnancy, check with your family medicine doc. And I think that's absolutely the right thing to do.
Holly asks, I know that you have said the best vaccine is the one you can get, but does that advice still hold true if I have a compromised immune system or cancer?
Okay, Hawk, I still think it holds true.
Simple answer is yes.
Yeah,
absolutely.
And I would say, it's interesting. The J&J vaccine is the only one that offered a dual track. That is, you could either have one dose or you could get two doses. I think it was 3 months apart.
Yeah.
That data will come out in July about how that fared versus Moderna and Pfizer. Now, Moderna and Pfizer just did the two-dose regimen in order to demonstrate the highest levels of efficacy. But I believe they're also engaged now in single-dose trials to see what this. My guess is these numbers are all going to look about the same.
Yep.
And I think to the point, whatever vaccine you're offered is the one to get. The J&J one looks really good, and it didn't have the 95% reduction, but it had 100% against hospitalization and death. So really, that's what you're going to care about. And I think I'm going to speculate, and it's pure speculation, that when the J&J data comes out in July, we're going to find that the two-shot regimen probably did 90% reduction in symptoms of any sort and continues this really high efficacy against death and hospitalization. And Pfizer and Moderna are going to end up around 60 to 70% after one shot, which is exactly where J&J is. So I think it's all going to come out to be about the same. That's my guess.
Yeah, and remember, these two trials, Moderna, Pfizer, and Johnson & Johnson, are separate, different trials. One is to look at a single dose, and one is to look at two-dose regimen. So you can't really draw a lot of conclusions between the two. So whichever vaccine you are able to get right now, go ahead and get it.
Yeah, I think that's really the key. And in the future we're going to have even more vaccination choices. There appears to be Novavax is on track, and there's another one's on track besides AstraZeneca. So we may have 5 or 6 vaccinations within months. And at that point, how are you going to pick? You're going to pick the one that people offer you. I do want to see all the AstraZeneca data. That's the one that's had the most controversy the whole time.
Yeah.
We need to see the U.S. data around that.
All right, Donnie's got our last question. She wants to know, has the average age of those hospitalized changed with the increased vaccination of the elderly?
The last thing I found, it had not changed yet.
Yeah.
But what has happened is our total number of hospitalizations have dropped dramatically, as you know. And so that's really the key. And I think the people who get sick are still the ones who get sick. They're just people who haven't been vaccinated. And we just don't see that much illness for people being admitted once they've been vaccinated. But you're still going to be a preponderance of those who are older.
Yeah, I believe our average age of people who are admitted to the hospital has remained about
60,
55 to 58 or so. And David Weil was on, and we kind of showed that. But the overall number of people coming to the hospital is much less, obviously. And just as you said, the number of people coming to our facility from a nursing facility is almost none. So that is a huge, huge benefit of the vaccines.
Hey, tomorrow morning, KDHE Secretary Lee Norman is going to join us to talk in detail about a big announcement that's going to be made today about exciting progress around the vaccine rollout in Kansas. I'm not sure what it is, but I got a suspicion, and I think it's going to be a really exciting program tomorrow because of that. And as promised, we also have Dr. Jennifer Vilwak. She's an ENT physician who's going to join us to talk about the Long Haulers Clinic and especially about her area around the loss of the sense of taste and the sense of smell. So that'll be fun. We've had a lot of questions about long haul as that's become more and more of an issue, and will your sense of taste and smell return? We'll hear from some great folks tomorrow, both about progress around vaccination and progress on the long haul clinic. Let me turn to Claudia and Ed. First, Claudia, final thoughts for today.
I just want to thank you for the opportunity to be here with you. And I'd probably like to invite you to be part of maybe a flyer that we can even translate into Spanish and send a message to our community overall around the vaccine. That'll be something really good for our community to hear from someone like you.
Claudia, we're all shaking our heads yes here with Jill and Hawkeye and I, so you let us know how we can help, and we'll be happy to try and help you out. That'd be great. Ed?
Thank you.
You bet.
Once Claudia connects to you, she won't let you go. So, Claudia, I love that you're going to get these guys engaged. Just want to say thank you for the opportunity to share the story of all these incredible Kansans who are working so hard in their own way to slow the spread and now to get people vaccinated. Also, just want to appreciate the KDH&E. It was actually Secretary Lee Norman who this idea came from, because he said one day, we've got to get more local leaders helping to slow the spread. We got to get more local people in communities. That idea led to a conversation, led to the incredible grassroots effort by so many Kansans. So a big thank you to KDH&E, and thank you to the two of you for having us on again. We really appreciate the opportunity.
We're delighted you were here, and thanks for your great messaging, all the great work you have done to help keep people safe. That's the best. Hey, last week we spent a little time looking back at a year of the pandemic, a year in our life, right? By commemorating the first COVID-19 patient that was admitted to our hospital. This week, we will hit another important milestone, our 250th episode of the Morning Update. That's a year's worth of updates. That's a lot. So we're going to indulge a little more retrospective this week. And so we're going to have a little recap of a year of living and a year of dying, as told with COVID with Dr. David Weil. But first, this thought. As the pandemic feels like it's winding down, don't let it wind up. Don't let it wind back up again. And the COVID-19 and SARS-CoV-2 are completely capable of winding up, just as they have several times throughout this year. Because remember, we thought we were going to have this big wave in April, and it came, but we were able to bend the curve. And then it came back in the late summer, we were able to bend the curve. And then in November, on November the 30th, we had our maximum number of COVID-positive patients here, 125 acutes. We were over 200 altogether. We had almost a third of our hospital with COVID-19 patients in it. And then we were able to bend the curve. SARS-CoV-2 would like to find a host. It would like to find somebody to infect, and it doesn't care who that is. So don't let it wind back up again. Make sure you continue to remember that those things which have bent the curve and have kept you safe the rules of infection control really do travel with you wherever you go. And that more than that, with the help of vaccination and the help of each other, hope, faith, science, and love, we can keep the curve bent. Let's hear this reminder from David Wild about what the year has been like.
The United States makes up 4% of the world population, but 20% of the COVID deaths documented across the globe have happened in the United States. Part of that is related to reporting and testing, but there is also, I think, a disproportionate share of mortality, of death in the United States. Also, interestingly, 30% of the vaccine doses that have been administered to date globally have been administered in the United States. Just a lot of sort of grounding points for reference when we talk about how things are going here. So these are the big picture numbers for the United States. 29.1 million unique cases in the United States out of a population of roughly 330 million. We also know in that conversation that while we have great high quality testing, we don't test nearly as much as many other countries across the globe. So that number is not high because we have the best testing per 1,000 population. And that 29 million and change cases led to 525,000 deaths in the United States in the last year. 29 million or 525,000 are sort of staggering numbers, especially for a single disease. Here are the Kansas numbers: 296,000 cases, 9,411 hospitalizations, and 4,816 people have died over the course of the last year in one state. And finally, some information or numbers about here. So 2,252 unique patients have been admitted to the hospital for COVID care alone. 331 deaths in the hospital. 644 patients hit the ICU. 400 of them needed to be on the ventilator. They were about 58 years old, and the average person over the whole course of the pandemic stayed in the hospital 8 days. But there are also some numbers that talk about how hard our teams have worked, which I think are important as well. 182,000 and change tests run just here alone in our lab. Over 35,000 vaccine doses administered here. Any one of those numbers individually, they're staggering. Some in a good way, 35,000 doses of a vaccine in not a large amount of time. And some are staggering the other way, right? 2,500 hospitalizations that maybe prevented others from seeking care here at some point in that time.